Hello and welcome back to Link Up and Learn with LiveBig. I'm Sarah. Today we're talking about behaviour, particularly in the context of ADHD and autism. For many families and carers, behaviour can feel more intense, more confusing, and sometimes confronting. Why is this happening? Are we missing something? And how do we respond in a way that actually helps? To guide us through this conversation, I'm joined by Jonas, a positive behaviour support practitioner here at LiveBig. We're exploring behaviour as communication, what might be happening under the surface, and how a positive behaviour support lens can shift not just what we do, but how supported people feel. Jonas, it's really good to have you here.
Thank you. It's really good to be here.
So these days, ADHD and autism are terms we hear more often. Can you help us understand what they are and how they can affect someone's day-to-day behaviour?
Yeah, there are definitely terms that we hear a lot more often. That's a good thing. There's a lot more awareness about the diagnoses, the issues that people face. And so the way that we actually define ADHD and ASD, we define them behaviorally, meaning that we look at different behaviors that someone does exhibit in order to set a set of symptoms that we then diagnose the disability. So ADHD really is a inability to regulate your attention. So obviously ADHD is attention deficit hyperactivity disorder. So there is that attention facet in there as well, but also the hyperactivity. Not all people with ADHD do have the hyperactivity. So sometimes you see hyperactive type, which means that someone's more hyperactive. And other times you might see combined type. So someone's like less hyperactive and also hyperactive in some contexts as well. So you do get a bit more of that spread of, and that someone doesn't just have to be like the loudest person in the room to have ADHD. So like generally there's a lot more impulsive behaviors to acting without thinking, difficulty putting off instant rewards for long-term ones. And then obviously with that, there's issues of self-motivation and emotional regulation challenges as well. There's just less of that tolerance to wait. So less sticking to tasks, more chopping and changing. There's that more impulsive behaviors. Actually, very interestingly, obesity is actually quite a common comorbidity with ADHD individuals as they age. So for kids, oppositional defiance disorder is the most commonly associated with ADHD, but as they age, obesity. And so that's a real testament to the person that really struggles to put off those longer term rewards, going for those short term rewards. And those things really prey on that person's inability to regulate their attention and motivate themselves towards the future. But when we do look at ASD as a different diagnosis, ASD individuals are quite interesting because there's such a large spectrum that they're on. So you can get some of ASD that's quite capable of, having a job, having a relationship, living a somewhat normal life with difficulties and challenges interlaid in that as well. Or you can have other individuals on the spectrum who really struggle in all areas of life, and they struggle with communication, really struggle with self-regulation, and are very unfortunately disabled in everyday aspects of their life and need a lot of support. So there's a very large range of different sort of severity of symptoms that you can have for some of ASD. So we say it's very heterogeneous. So when you are working with someone with ASD, it is very important that you do treat the individual. ADHD is a bit more about understanding the diagnosis and treating the diagnosis, but with ASD, it's very much about who's the individual. Yeah, ASD is very much about who is the individual, who are you treating, and how can you exactly manage the symptoms that that person is experiencing. So, yeah, what's interesting about ASD as well is that there's definitely a lot more like depression and sort of that internalized distress. As a person ages with ASD, there's a lot more of that internalized stress, a lot less of those behaviors that we do see later in life. So for parents who are very concerned about their child's sort of difficulties with their behaviors as a child, those behaviors do tend to sort of decrease as they age. However, unfortunately, with that as well, there's more anxiety and depression as that person does age. Interestingly, there's more anxiety, especially in females as well. So that's sort of the individual understanding the differences that they do experience in society and sort of that how that impacts them as they age as well. So that, yeah, relationships are and social communication really is a huge part of ASD. When we're looking at ADHD versus ASD, ADHD is more about performance rather than knowledge. That's why you can get someone that you just keep telling them the same thing over and over again. They keep doing the same thing that you don't want them to do. And that's not really a failure of them listening and just obliging or just deciding that they don't want to listen to you, but it's because they really struggle with that performance aspect of the task. However, with ASD, it's more of that knowledge aspect. They need more knowledge, they need more context. So, understanding the context around things can be really difficult for them, and they need a lot more assistance with that.
When families and carers come to you and to Live Big worried about behaviours, what are they usually hoping someone will help them understand?
Yeah, definitely. I think families really want reassurance, obviously, not judgment. There's definitely a desire to understand why. The why can be like very, I guess, nuanced and different for every individual. And but it is so important to really understand again what the person does struggle in. Like I just talked about with the ADHD with the performance and knowledge thing. Like that's really important to understand because you can be a parent that's very frustrated your kid who just keep telling the same rules to and they keep doing the same things that you don't want them to do but not understand that's a failure diagnosis, not the individual, is really important. So I think it's really, really important. What's great for them is to understand, okay, what is something that we can change and manage through like a behavioral lens, and what is something that is an integral part of the diagnosis that they're going to struggle with, and maybe we have to, treat a little more gently in that case. There's definitely a lot of overwhelm, confusion, guilt and failure as well. Those can be very strong emotions. So again, it's just really important to just understand what's actually in your control and what's actually not in your control. And that can be really important when you do understand these diagnoses, yes.
And often they're carrying a lot by the time they reach you. So let's talk about autism and behaviour specifically. How might behaviour be used as a form of communication for autistic individuals? People often hear terms like autistic meltdowns. How are they different to everyday temper tantrums? And what tends to trigger them?
Yeah, I heard a really interesting comment once. I can't remember who it was from, but it's a bit like having autism and struggling to communicate in normative sense is a bit like going to another country and not knowing the language. So when your communication fails, even your nonverbal attempts, your instant like reaction is to become frustrated. Frustrated you can't get your needs met, frustrated people can't understand you. And so that's a big reason, why these communication breakdowns and cause behavior and why speech pathologists and communication strategies in general are so important when that individual does struggle with communication as well. Autistic meltdowns are a little bit different in terms of someone with autism really struggles to process information, not because it's happening too slowly or too fast, but more so the circuitries in the brain are wired too inefficiently for things to sort of happen rather fluidly. So things get stuck, some things miss. The person really concentrates on small things that someone's doing and misses other things. So you sort of miss those nonverbal cues, get sarcasm wrong, and all these other things happen. So the person is exerting so much cognitive capacity in everyday sense, social communication, just in general, just viewing the environment. Again, some individuals can be more sensitive to visual, while others don't. Others are more sensitive to like touch and like sort of the feeling of different materials, while others aren't. Some struggle to process noise, some don't. Noise is quite a common one. So when that person is exerting so much cognitive capacity in a social sense, processing struggling to process in like a audible or visual sense, then essentially that person's cup just gets completely emptied and their window of tolerance, completely evaporates. So they end up just having a bit of a meltdown, which is very similar to how anyone would feel if they'd been running on no sleep for like 2 days and someone had just bumped into them. You just feel angry, frustrated straight away. And it's more of that lack of tolerance and sort of the difficulties with just everyday life can cause these meltdowns. So it becomes so important to get OTs involved because like sensory integration, like using preferred sensory, items or materials or sounds can be so helpful to calm the person down. And if you sort of intermittently experience these preferred sensory experiences throughout the day, you're more likely to be a little bit more calmer because you can offset the sort of negative or harmful sensory experiences that you might feel. Because if there's none of that sensory integration or space or ability to retreat, then you end up just getting depleted quite easily. And then you have no more tolerance and then things become really difficult and yeah, behavior generally follows that.
So, what are some of the common reasons or triggers behind behaviors linked with ADHD or autism? And more importantly, how does understanding the why change how parents and carers respond?
I tend to stay away from like triggers a lot of the time. Triggers can be, I think, in my opinion, which is different to others, of course, but I tend to think that triggers are a little misleading. Like just like
Yeah.
explained before, that person that's struggling to
Mhm.
process social interactions, visual stimuli, touch or audible stimuli, suddenly someone sneezes loudly near them and they, you know, become really dysregulated. Was it the sneeze that caused that behavior, or was it the stuff happening before that point to cause that behavior? So, when we're talking about the stuff that happened before, we're talking about the setting events. So, what the events which sort of lay the grounds for that trigger to actually cause the behavior? I think, yeah, triggers are important to know. Obviously, if a trigger continues to happen like all the time, like, I think they're especially important when you're looking at somebody with, like, trauma, which can be common, unfortunately, individuals, with ADHD and autism.
Mhm.
So, when we're talking about trauma triggers, that's important. Like, you should definitely understand what they are and find ways to avoid or
Yeah.
manage them. But when we're talking about just like general triggers for behavior, I tend to focus more on the setting events. So, what are the diagnoses of the person and what are those difficulties? So, if we understand the person has ASD, for instance, we understand that they're probably going to have some issues with social communication. It's going to be quite draining for them. Maybe they've got a sensory profile done and sound is really difficult for them. So, maybe we put some headphones in to help them, manage that sound. Some people sort of say sound is a trigger as well, but I sort of see it more as a setting event because it's something that doesn't shift. Like that person does struggle
Mm.
with that sound integration, and that's what causes that behavior. So yeah, I think that's more important essentially. When we're looking at the why, I think it's more important to go, well, what are the diagnoses of this person and how do the symptoms that they have actually cause the behaviors? I like to focus on that more as a why. In terms of just like the general functions of behavior that probably a lot of people hear about, which is like escape, attention, sensory, automatic, those kind of things, those can be really helpful as well, especially when someone can't communicate. Because if, for instance, somebody is hitting, I think that it's not overly helpful to say, well, that person struggles with emotional regulation because of their symptoms of autism. That doesn't really tell you much. I think it's more helpful to go, all right, this person's trying to communicate they want to leave or they want attention. That's more helpful in that context. When we're looking at the function of behavior, that why, I think in autism, especially ones that cannot, especially the individuals, I should say, who cannot communicate in a normative sense verbally, yeah, the function of behavior and using those assessment tools, like the question about behavior function, can be really helpful for those individuals. I say when we're talking about ADHD, I think we're talking more about the diagnoses and sort of those things as well, because those are really integral to why the behavior occurs. Um, and often individuals with ADHD alone are able to communicate as well. So I think the diagnoses are more important when asking the question of why in ADHD, and sort of a mixture between the function and diagnoses are helpful when you're talking about ASD as well.
Well, you've talked about now how important it is to understand the why. And that's where, like yourself, a positive behavior support practitioner does come in. How do you approach these situations at Live Big? Can you talk us through how you support someone with ADHD or autism around these behaviors? And how do you tailor that support for each individual?
Yeah, I think it is really important, like the last point you made about tailoring that support to the individual. I think you always have to treat the person in front of you, um, ASD especially, but even with ADHD as well. I mean, everyone's so unique. The settings around that person can be unique as well. So some things that have worked with someone else with ADHD might not necessarily work with the person you're working with ADHD, because the settings around that person are different. They might not have the strong, connections around them, interpersonal connections that can support them in the ways that maybe someone else could. Because with both of these disabilities, it really needs a lot of people around them to assist. With ADHD, it's about reminding the person, creating structure and reward programs so this person can do better with their performance in behavior. When we're talking about ASD, it's about, making sure that person can escape when they need, has the tools they need, can sensory integrate when they need, and gets social scaffolding as well. So they're not just left to their own devices in social situations, which can be challenging for them. So yeah, it is really important. Like I said earlier, that question about behavior function assessment can be really helpful with individuals with ASD, just understanding what the behavior functions as, especially if communication is difficult as well. And yeah, when it does come to ADHD, there's not necessarily assessment that I use. It's more about understanding the diagnoses. I mean, you can look at something like an overt behavior scale. That's more of a good way to like measure your, I guess, interventions over time. So, I'd start off with doing an overt behavior scale, a few months in, and then maybe another 3 months or 4 months down the track, you do it again and see how your interventions are going, especially if it's a little unclear, if they're working or not. You can do that and you can show the family, like, look, this is where we were at like a couple months back. The behaviors were at a 5 and now they're at a 3. So we're seeing a little bit of change. And just understand that changes are going to be gradual as well. They're not going to be like, that instant. They're going to happen over time and sometimes slowly and sometimes not as fast as we expect. But a lot of these, like interventions and strategies, they're built on consistency, consistent approaches, and consistently using it over time in all of the environments that that person needs the support.
It's clearly never a one size fits all approach. So, positive behavior support is often described as evidence based. In real life, what does that actually mean for families day to day?
Yeah, I think it is a term that we use a lot. I think that like some of I think techniques, evidence based, the ones that we use a lot of, such as like box breathing or it's mindfulness strategies. There's good research behind that. Token reinforcement strategies in terms of ADHD. There's great research around that as well. It it does become difficult because obviously we're not all scientists who can spend hours and hours doing literature reviews and really getting into the nitty gritty of everything. I think what's really helpful, especially if you are a practitioner, is really just leaning on the specialized supports in the team of the person, but also people you might work with as well. So if you have a client who you believe struggles a lot with sensory integration, can you talk to an OT about that? They're going to have more of their specialized skills. Their strategies are going to be more evidence based, likely, because they've done the training around those specific skills. We're talking about communication. Can you communicate to a speech pathologist? Again, their skills are going to be a lot more evidence-based as well because they've done the training in that specific area. So I think what's what's helpful and what's great about PBS is that we do, I guess, oversee behavior, which has so many different avenues to the reason why it occurs and the deficits that person have. They might have psychological distress, sensory integration problems, and speech issues. So like as a behavior support practitioner, can you talk to a psychologist, speech pathologist, and occupational therapist and get those evidence-based approaches around that person? So you make sure that you're using an evidence-based framework when you're working with a family as well.
So, at the end of the day, when behavior is understood and supported well, what difference do you see it make over time for the person and obviously for their family?
Yeah, it can be huge. I think with the education component that I spoke about in the beginning, that can bring a lot more clarity and
Mm.
understanding. And there's just a different way that you do view or approach behaviors, even if they're not particularly changing at first, but the way you view them is different. So for that knowledge aspect of ADHD, if you're just viewing it as a failure on yourself, that you're not able to get this child to do what you want them to do, but then understanding that, oh no, this person has a failure of their performance, there's a lot more of that shame on yourself. It's not a failure of the way you're
Mm.
doing it. What it is just a failure of the diagnosis. So again, it's the education component is really helpful at just bringing more clarity to what you can and can't control. Yeah, with obviously
Yeah.
successful interventions, there's a lot more reduced stress. There's a lot more framework around those crisis moments because obviously we do a lot of response strategies as well. So responding to behavior. So the person or the family, the caregivers, the support workers have a lot more clarity about what they should do in those instances where things are happening very quickly. There's a lot of emotion and there's less time to think about things and sort of work through them at a slow rate in the moment. You need to know exactly what to do, where to go, and what to say. So those things can really help during those crisis moments as well. Like improve relationships and communication. So those are massive. Obviously, big for families as well. Improved relationships can be really helpful. You know, when there's a bit more of those positive experiences going on, there's definitely a lot more hope and a lot more positivity and communication. And if the person learns to communicate in a better way, more functional way, then sometimes less behaviors as well, which is really helpful. But also the person just has more capacity and the quality of life increases as well. Yeah, greater confidence for everyone involved as everyone kind of knows what to do. So that's obviously super helpful as well. Yeah, increased participation as the interventions are successful. There's obviously going to be increased participation for the family and more independence for the person. So as I spoke about before, that quality of life element of it all, we really want the person to reduce their behaviors as well, but we also want them to have an increased quality of life. That's a very important part of positive behavior support is that quality of life aspect of it
Mm.
as well. Yeah, better emotional regulation can be helpful in terms of behavior and quality of life is very important. Emotional regulation is something that we do address in most of our plans as well. And most OTs and speeches also work around emotional regulation as well. So with great emotional regulation, you see, more functional, more better helpful behaviors, which can be really helpful for the individual.
Well, that feels like such a hopeful note to end on. Jonas, thank you so much for helping us better understand ADHD and autism and how they relate to behavior.
Oh,
Having
you're
me.
welcome. Thanks for having me.
If you're listening today and this episode has resonated, we hope it's offered some reassurance. Understanding behavior can take time, but with the right support, it can start to feel more manageable. If you'd like to learn more about positive behavior support or how LiveBig can support individuals and families, visit livebig.com.au or reach out to our team. We're here to help. And as always, don't forget to subscribe for more conversations like this. Thanks for listening. We'll catch you next time. We acknowledge the traditional owners of this nation, whose country we work and live in. We recognise Aboriginal and Torres Strait Islanders as traditional custodians and their ongoing connections to land and sea. We pay our respects to elders past, present and emerging, as law keepers of the world's oldest living culture. We celebrate the stories, culture, and traditions of Aboriginal and Torres Strait Islanders so we can, in the true spirit of reconciliation, continue the journey together.